I've always been interested in special needs pediatrics. One of my friends in middle school actually had a brother with cerebral palsy, and that's really what sparked my interest overall, specifically in the field of CP. Our big goal is really looking at the whole person and not just one injury or one problem, but really looking overall at their day-to-day function and getting them back to everything as easily as possible. So working a lot with physical therapists, occupational therapists, and speech therapists to really rebuild that whole person again. We value what families have to say. We value what's going on in your life, and we tailor our recommendations as much as we can to the individual and the family. So no one's the same. No recovery from any injury is going to be the same. So we do want to really work closely with families while still recovering the patient as quickly as possible.
Her speech and her language are starting to really come out, although she's more shy around people that she doesn't know as well.
Thinking about families and patients that really stood out, this was a 13-year-old who had had a concussion about a year prior, seemed to have recovered completely, and then all of a sudden started showing symptoms that were very similar to his concussion without having another injury. And over time, and I had actually been seeing him for several months at this point, all of a sudden this very bright boy had stopped being able to read. He couldn't read anymore. He couldn't comprehend what was being said on the page. And over time, and in spending time with this family and really listening, we were actually able to figure out that he was having seizures. And I put him in touch with an epileptologist who was really a specialist in this area. Once we treated that, all of a sudden he's back to reading. He's back to school. He's back to being with his friends. And the parents said, you know, we have our son back. We haven't had him in 2.5 years, and he's finally back. And that's the piece that's so rewarding. And not just with this patient, but overall in every patient we see in that field, to be able to give parents their child back, or to get the child back to school and their friends and all of the activities that they like to do. That's what this field's about.